External and internal hemorrhoids treatment can vary for each kind. These can be suppositories, pills, creams, some common home remedies, banding, chemical injection, or surgery. But a mild hemorrhage need not be a cause for worry, as this would only need a little change of lifestyle, such as indulging in some simple exercises and a healthier diet that includes lots of fiber. Usually, for sufferers of mild hemorrhoids, the problem will improve within 2 weeks' time, while a complete cure can happen within 6 months. Symptomatic treatments. Hemorrhoids treatment for the short-term stage can include astringents and lubricants, anesthetics, vasoconstrictors, regular sitz baths, as well as pile cushions. Painkiller ibuprofen can also help either in the tablet form or as a gel, which can be applied directly to the affected area. These symptomatic treatments are only meant to ease one out from the symptoms, but they don't really treat the cause. For long-term and complete treatment, there are other ways to go about it. Combined treatments such as herbal medicines and over-the-counter medications can help in the healing process and give a sufferer the relief from pain, swelling, and discomfort from a hemorrhoid. Simple home treatments for external and internal hemorrhoids. Hemorrhoids treatment for external and internal bleeding hemorrhoids can begin with 20 to 30 grams of daily fiber intake. Some doctors may even recommend close to 100 grams for people currently suffering hemorrhoids to avoid constipation. These are readily available in vegetables and fruits, beans, and whole grains, so it should not be difficult to have fiber every day. Fiber supplements like psyllium husks or ground flax seeds are options if one is not comfortable about getting them from high-fiber foods. Drinking at least 8 glasses of water daily will also help one to avoid constipation, which can aggravate hemorrhoids due to the straining, especially when there is already bleeding in the affected area. Hemorrhoids treatment can also be done by taking 2 to 4 20-minute sitz baths in warm water and simple daily exercises such as walking to help treat bleeding external and internal hemorrhoids. Internal bleeding hemorrhoids. For internal hemorrhoid bleeding treatment, one can only check with the doctor for prescription remedies such as internal creams, as there are no available FDA-approved over-the-counter internal hemorrhoid bleeding medications yet. External bleeding hemorrhoids. Hemorrhoids treatment for the external bleeding type are many and varied. They are classified as over-the-counter medical remedies, herbal treatments, and home remedies. They can either come in the form of creams, suppositories, or pills. Over-the-counter remedies. Vasoconstrictors. This suppository causes the blood vessels to constrict or tighten up to reduce the swelling and bleeding. One may need to consult a doctor first before using this, as it can react with other drugs. Anesthetics and analgesics. These suppository painkillers can also reduce swelling and remove pain and can also be applied to internal hemorrhoids. Laxatives. This can help with constipation, but caution must be observed to avoid dehydration, as this is not usually recommended for long-term use. Calamine. This can be found in Sunday blocks, zinc oxide creams, and diaper ointments, and can help in bleeding hemorrhoids. Astringents. Astringents cause protein clumping of the skin that helps to dry and reduce itching, pain, burning, and bleeding. Hydrocortisone. This steroidal cream is an effective and powerful anti-inflammatory medication, but is not recommended for long-term and regular use, as it can cause the anal area's tissues to get thinner, resulting in decline of muscular support of hemorrhoidal cushions, thus will only worsen the health condition. Vitamin B6. This vitamin is considered a good and practical treatment relief which works best for sufferers who lack this vitamin. Herbal and home remedies. Witch hazel. This herbal extract cream has an astringent effect and helps to soothe and reduce inflammation and bleeding in external hemorrhoids. Apple cider vinegar. Using a clean cotton for application to the affected area, this home remedy is considered an effective treatment for bleeding external hemorrhoids. If you want the best complete guide to cure hemorrhoids warranted for 60 days that helped me to eliminate hemorrhoids, visit the link below this video. Good luck.